Hello, this is Dr. Castanet with another video clip for you for the blog. This one is going to explain what we see on neck x-rays. This is a neck x-ray from the side. It is the most valuable of the neck images for evaluating necks diagnostically. We can learn a lot about this in terms of stability of the neck. We can also see the extent and severity of degenerative changes in the neck. So let me orient you to some of this. Obviously, this is the jaw of the person. You can see the teeth themselves, when they're normal, are visible through the jawbone. This very white area here and here is dental work. So dental work with metal is even more radiographically opaque or whiter in color. It looks to me like there's some fillings here and here. In terms of the neck itself, you can see the little bones or vertebrae in the neck. This is the skull up there. The neck in almost all mammals contains 7 vertebrae. There are exceptions of a few animals, including a couple of sloth species and a couple other animals I can't presently recall, but humans always have 7 vertebrae in the neck. This neck is almost straight. Most necks, and optimally we think, necks ought to have a curve. The curve probably serves many functions, including dissipating axial loads more effectively than a straight neck. But we do see straight necks frequently. They do correlate with more often with neck pain, but the neck pain is not universal in straight necks. So we don't exactly understand for sure the relationship between straight necks and neck pain or degenerative changes. We just know that there's some correlation there between those things. In terms of this particular neck, this is the first cervical vertebra there. The second one is there, the third, fourth, fifth, sixth, and seventh. The seventh vertebra, if you look at these bones, well, these are the vertebral bodies, we call them. These are the spinous processes. These things are little projections off the back of the vertebra that you can feel in the back of your neck in the midline. These here are quite small, and then this one is very prominent. We call this the vertebra prominens. It's the C7 vertebra, the process off of it. Many times when people have neck pain, they will feel the back of their neck, and for the first time they'll note this bump, the prominence of the bump back there, and ascribe that or correlate that somehow with their neck pain, thinking it's perhaps causal or a reflection of the neck pain. It's natural for them to think so because the first time they probably felt back there, they may have had pain back there, felt back there, and thought they were connected just because the pain was felt back there. Or it seems odd, and it is odd. It is the prominent one among them, but that's perfectly normal to feel a prominence back there. Everybody has it. And in terms of these vertebral bodies, you can see that if we go up towards the top, this disc space between these two vertebral bodies has a pretty good height. This height of this disc is less, so it's partially collapsed as part of the degenerative process. When they collapse, there's more stress on the bones, and the bones become more dense, and that's reflected in a more white color on the x-ray there. That's true at this level as well. It's less true at this level where there's more disc height. It's truer again at this level. You'll notice that the bodies, the bones also become a little misshapen with what we call bony spurs at the corners of the bones there, not present really here, and present there again there, and present there again there. I'll make another couple notes here. These two vertebrae are special. There is no disc between the skull and the first cervical vertebra, and this joint here is largely responsible for us nodding our heads up and down. Most of that movement happens between the skull and this first articulation, as the condyles of the skull they sit in little joints that enable the skull to nod on top of that joint. If you look at this vertebra and this vertebra, this relationship is interesting too. because this vertebra you can't see from the side, but it looks like a donut ring. And this one sits on top of this second cervical vertebra, and the second cervical vertebra has a projection that goes up like this and provides an axis of rotation for this vertebra. And what's unique about this joint down here between the first and second vertebra is that this is where most rotation of your neck occurs. So if you rotate right and left, side to side, most of that movement is happening here. These other joints contribute some in terms of nodding and in terms of rotation, but mostly what happens here is bending your neck side to side, as well as putting your chin down to your chest or looking way up at the ceiling. That's what happens throughout most of these. The neck is highly mobile, and as a result, there are a lot of physical demands on it. And as a result of that, we think it doesn't recover perfectly from every day's wear and tear. And over time, you accrue degenerative changes that can be appreciated on this imaging as I enumerated, with loss of disc height, bony spurs, sclerosis of the bones here, sometimes straightening of the neck perhaps, sometimes instability where one bone will slide forward on another. That's of greater concern than some of these other changes. In terms of qualifying these degenerative changes, I would say there's little to none there. It's moderate there and there, little to none there, perhaps moderate at this level as well. And this one's a little harder to see between the seventh cervical and the first thoracic vertebra. Keep in mind, this first thoracic vertebra, if you could see better through all the musculature here, which normally does, and in this case does, obscure the vertebrae in the middle back or thoracic area, you would see a rib articulates with this one. In any case, if you have neck or back pain, let me make one other point about this. Maybe the most important. The reason I'm showing you this and these changes is the nature of all these changes, whatever they are specifically, whether it's a spur or loss of disc height or collapse or sclerosis of the vertebrae, these reflect a compressive process, a process that is by its nature compressive. And that is what gives rise to people's neck and back pain. It tends to be slowly progressive over a lifetime. There can be little acute episodes that result in acute pain. Often it's forgiving when you're younger and you recover from these episodes without needing medical intervention. Other times, particularly as you get older, you need some treatment to redress these changes. But because they are compressive in nature, this explains why the most effective treatment is to decompress these structures. It's not to do exercises for this, which can be helpful and it benefits you long term, but in terms of pain, since this is a compressive process and pain episodes are usually reflections of modest changes in the compressive process, the most effective treatment for this is to try to decompress the area. The way you do it is essentially with traction, and the more sophisticated traction tables are better than the old ones, much more effective as a result. They're not real common because they're very expensive to provide, but they're well worth it because they directly address the cause of neck and back pain for most people. And doing things like popping joints is a relatively silly means of treatment for the compressive problem that causes these pains. My name is Dr. Castanet. That's how I've treated most of these problems for the last 17 years. I've been in practice 36 years now and treated these in all sorts of environments. I spent 18 years on orthopedics, 5 years in a neurosurgical practice. I've worked with physical therapists, physiatrists, i.e. physical medicine doctors, orthopedists, neurosurgeon, other chiropractors. And the most effective treatment I've seen for these kinds of problems in patients most of the time is to provide spinal decompression. That's what I've done the last 16 years with much greater success rates than I had in those other physical environments that were non-surgical. Obviously, I'm not competing with surgical treatment, although I can sometimes provide an alternative for surgical treatment. But when surgery is indicated, like anything that's indicated, it can be a blessing. But if you want non-surgical treatment and the most effective available, I think spinal decompression is what you ought to look for. I'm Dr. Craig Castanet in Decatur, Georgia. My number is 404-558-4015. My website is backstrong.net if you'd like to learn more. I have a number of videos there, and you can also go from that website to my YouTube channel with the YouTube icon and learn more by watching other videos on a variety of spine-related topics. Thanks very much. Bye-bye.